Thank you, Mr. Speaker. I am going to be joined this evening by Republican freshman colleagues of mine, and this session will be co-chaired by my fellow freshman from the great state of Minnesota, Mr. Eric Paulson. Eric, thank you for joining me this evening, and our other freshman colleagues will be joining us shortly. We're going to be talking about health care from the perspective of freshmen. We're going to be talking about some Republican alternatives to the large bill that the Speaker introduced last week and unveiled, and that we're discussing this week. And we'll be doing some comparisons between bills that Republicans have to provide better solutions, take incremental approaches, address the most important concerns that the American people have about their health care system first, and the need to take a very deliberate, careful approach to changing an American health care system that needs tweaking rather than throwing out and replacing. And I yield to my colleague from Minnesota, Mr. Paulson.
Well, thank you. I thank the gentlelady for yielding and for organizing this little discussion tonight. And I know we're going to have some of our freshman colleagues joining us. And I think first and foremost it's important for me to outline, I think you'd share this view, no one is denying that our health care system is in need of reform. And certainly as a freshman member, I know that the members of our class, actually both Republican and Democrat, know that there need to be changes in the status quo. And I know the Republicans in particular, the freshman class, have been very frustrated that the media may not center or focus on some of the proposals that we actually have offered, because as you indicated, there are some very incremental approaches and piecemeal approaches that actually could be done and could be done bipartisanly to show success and progress in helping lower premiums for families, for individuals, for small businesses. And I think as most of the public is well aware now, just this last week we had dropped on our desks a 1,990-page bill, which is a huge mammoth bill, and we can bring that up a little later for a prop, but it is a big piece of legislation, and I know we're going to be voting on that later this week. And I think I've come to realize in my first few months in office, as probably you have, Washington is a place where actions are often taken without properly weighing the consequences and the impact of those actions. And I think the bill that has been laid before us is very misguided in that it's going to have a heavy tax load put on the small business community. It's going to tax medical device companies in particular and medical device products, which impacts my district very greatly and the jobs there, and we'll talk a little bit more about that in a little bit. But our goal also is to make sure we're providing adequate coverage and lowering cost health care premiums for all Americans and individuals and families and small businesses, because it is a pocketbook issue. But I think the approach that the majority is taking is a very misguided approach, and we're going to have some discussion about that tonight and some of our alternatives where I think make absolute common sense. I'd like to yield back.
And I look forward to having our colleagues join us so we can discuss some of those. We have been maligned as a party for not having a health care solution to counter the Pelosi approach and the Obama approach to health care. But in fact, we have over 53 bills that you can read online that will address health care reform. And we offer and challenge the Democrat leadership who controls this Congress to pick and choose from among the better ideas that Republicans have and bring some of those bills through committees and to the floor so we can debate them openly in a transparent manner. They were not crafted behind closed doors, as was the Democratic bill. They were crafted in the traditional manner with the help of legislative draftsmen and women to address specific components of our health care system in a way that they can be aggregated into a larger reform package or addressed individually if we prefer, so we can have a healthy debate on a variety of subjects. Even the Chicago Tribune noted recently that Republicans have a number of great ideas. Here's an excerpt from a recent editorial in the Chicago Tribune. GOP proposals contain smart ideas to increase choice and competition in the health insurance market. These excellent ideas could expand coverage for the uninsured without cratering the federal budget or curbing the competition and innovation that drive the U.S. healthcare system. My colleague, Mr. Paulson, is on the Financial Services Committee. I am on the Budget Committee, and among the things that he and I have seen in our committee work in the last 10 months is that we are aggregating more debt than George Washington through George W. Bush combined, that while our colleagues on the Democratic side of the aisle criticize Republicans for spending too much and their need to inherit a deficit, in fact, since we arrived in Washington, we freshmen, along with the Pelosi Congress, they have increased the deficit, doubling it in 5 years and tripling it in 10. So it is not an excuse that they inherited a deficit. Indeed, they did, and indeed, Republicans predating Mr. Paulson and I did overspend. But you don't solve an overspending problem by making it 2 times worse in 5 years and 3 times worse in 10 years. And our approaches to the health care bill are to advance solutions that will not add a dime to the deficit. How many people believe that the $1 trillion plus Democratic health care bill is not going to add a dime to the deficit? In fact, a poll recently showed that more people believe that we'll discover life on other planets than that the Democrats' health care bill will not add to the deficit. The Republican bills, however, do not add a dime to the deficit, and here are 3 of them that I'd like to highlight this evening. As I said, there are 53 on a website that I'll provide to you later in this discussion. One of it is H.R. 3400, Empowering Patients First Act. The prime sponsor is Representative Tom Price, a physician from Georgia. It is the product of the Republican Study Committee. The bill uses a mix of new tax credits and deductions to make the purchasing of health care financial to make the purchase of health care feasible for all Americans. The bill expands the individual health insurance market using association health plans and interstate health insurance shopping to give people more choices. The bill encourages the creation of state-based portals so people can compare plan prices and benefits. For those with pre-existing conditions, the bill redirects unspent stimulus funds towards state-based high-risk pools. And importantly, this bill is fully offset through redirecting stimulus funds, stepping up efforts to root out waste, fraud, and abuse in our entitlement programs, reducing defensive medicine through medical liability reform, and capping discretionary spending. This bill scores in the favorable column. Another bill sponsored by Representative John Shadegg of Arizona, entitled Improving Health Care for All Americans Act, has many of the taxation provisions incorporated into it that were eventually added into H.R. 3400. And then the Patient's Choice Act, which is a fun one to highlight because it takes a little bit different tact, is sponsored by Representative Paul Ryan. And its bill provisions include some reforms that are badly needed to Medicare and Medicaid without decreasing benefits. And I yield to the gentleman from Minnesota.
Well, and I think, as you just mentioned, thank you for yielding, there's no doubt that there have been other Republican plans that have been offered. And there's a variety of bills, 50-some bills that have been out there. In fact, all of these, nearly all these pieces of legislation have actually been introduced prior to this mammoth, nearly 2,000-page bill that's been dropped on our desk just last week. And I want to go back to some of the comments you made earlier about the deficit, because as someone who came to Washington fully acknowledging and recognizing that Republicans were part of the problem on deficit spending many years ago, that is no reason to continue to do the same. And seeing ourselves now face our very first $1 trillion budget deficit is of great concern to me. I know it is of great concern to my constituents for their children and their grandchildren, thinking the share of the national debt for each person now has gone up to about $38,000. Compared to when I was born, it was about $1,500 per person. And so at some point, we are going to have to pay back that debt, and that's going to fall, it's a heavy burden that's going to fall, unfortunately, on our children and our grandchildren. And the bill that is being proposed by the Speaker does not address health care costs. You mentioned earlier that there's not a good track record of government introducing legislation and having it be cost-effective or innovative. The reality is, if you look back at 1965, congressional forecasters at that time predicted that Medicare would cost about $12 billion in 1990. You know what its actual cost came in? Its actual cost came in at $90 billion. And today, just like Social Security, it is now on a path to insolvency due to runaway costs. And so we have massive problems with existing entitlement programs. It doesn't seem to me to make a lot of sense to enact a new entitlement program that the government doesn't have a good track record on. And I yield back.
The gentleman from Minnesota has 4 really cute little girls, and I carried one of them's Scooby-Doo backpack through the Minnesota airport while we were transferring planes trying to get back to Washington for votes. A lot of us have kids or grandchildren that will be affected by this legislation because they will be paying for it for years to come. And one of the things that we all learned from our parents in this baby boom generation is the importance of handing a better America to your children. And that is something that I don't want to be responsible for being the first generation to renege on. And that's why I'm so much more supportive of these Republican bills than of the Speaker's bill. Among the things that are in the Republican bills that are so important are meaningful tort reform. And I say this with a caveat. I'm one of those Republicans who would rather see tort reform done at the state level. I think we see more innovation and creativity. We see some states that want to have caps on non-economic damages. We see some states that want health care panels, states that want to make sure that expert witnesses within the certain specialty that is charged with malpractice are the ones that are designated as witnesses. There are a whole variety of ways to address tort reform. I prefer that it be handled at the state level, but I have signed on to several of these bills that have state tort reform provisions even at this federal level because I think they take a much better approach to the overall subject of health care reform. So in other words, the Republican plan has meaningful tort reform. Oddly, the Speaker's bill contains a provision that says they'll give out grants for innovations in tort reform, but not to states that have placed a cap on non-economic damages. And if you talk to some of the former legislators, now members of Congress, who are from states that enacted caps on non-economic damages in medical malpractice cases, you will learn that their medical malpractice premiums for their physicians dropped, thereby allowing their physicians to either charge their patients less or stay in practice in small communities where they don't have as many patients to spread out the costs of that extremely expensive malpractice insurance premium among. Then we have interstate health insurance shopping. This is really what I think is going to be one of the most exciting keys to reducing the costs of health insurance because it's going to create more competition. Coming from the smallest population state in the nation, Wyoming, and not being able to buy insurance across state lines for health care the way I can for automobile insurance, I don't have the options because of our little small pool of citizens to spread the costs among. So it's going to be very important that we have the ability to shop for health insurance across state lines, and that we do it in a transparent way. You know, I see these ads on TV for car insurance. Well, there's a little sign that you look at that compares one company's premium to another, and you can go online and shop and compare and put in the kind of factors that you want in your automobile insurance. We should be able to do that for health insurance. We should be able to buy our health insurance premiums that way, and the Republicans' bills will allow that to happen. And then further, association health plans. The Republican plans have it, the Democrat plan does not have it. And association health plans, once again, would allow groups with some common interest to pool, to create a larger pool, whether it's your church denomination, your Rotary Club, your alumni association, or any other group that wanted to form an insurance pool for purposes of providing health insurance to their member participants. This I call kind of an equivalent to what's available in the banking community. You have commercial Main Street banks, and then you have some credit unions, and I kind of associate this kind of a association healthcare plan with the notion of a credit union. So these are things that we have that would increase and stimulate competition in the private sector, and these are in the Republican plans. They are not in our colleagues who are members of the Democratic Party's plans. Now I'd like to call on one of our colleagues who is from the state of Colorado. Mike Kaufman is here this evening, and from my neighboring state of Colorado, and I yield to you and thank you for attending this evening's discussion.
Thank you, Representative Lummis. You know, I think what is of concern to those of us from Colorado, and I think many people across the country, are what is the impact upon jobs and employers. And so there's a concern about small business in particular. There is a provision in the Pelosi bill, that the Pelosi Health Care Reform bill, that has a surcharge on small business employers. Now, granted, it has moved up to where it was in the first version, H.R. 3200, where it was if somebody had the average annual payroll between $250,000, then it started as a surcharge of 2% up to $400,000 in average annual payroll with an 8% surcharge. That number has been moved up a little bit, but I think it's still going to be devastating to the economy, where $750,000 and above, it's an 8% surcharge, and then it's graduated a little bit down below that. And so to put a surcharge on employers, a payroll tax, if you will, on employers that are just trying to keep their doors open, to be able to make the payroll that they have, I think is going to be devastating and a job killer to this economy. And I think we ought to focus on job creation and not job killers.
The gentleman is correct. In fact, we have found that studies determined that 5.5 million more jobs will be lost as a result of the taxes placed on small businesses under the Democrat version of the bill. And furthermore, that there's a double whammy for small business. For businesses under 500,000 in payroll, there's not a big hit, but of course a lot of businesses in my state of Wyoming, there are 1,400 in my state of Wyoming, that will be hit because they pay these taxes at the individual tax return, but they're small businesses who pay payrolls of more than $500,000. 1,400 businesses in Wyoming are going to be slapped with that tax, and I yield to the gentleman from Minnesota.
Well, thank you. Maybe I'll just ask the gentleman from Colorado to yield to a question. I'll ask